morning, sir. Can you kindly introduce yourself, please?
Hi, I'm Prithvi Mohandas, and I'm the Managing Director of MIOT Hospitals.
All right, so thank you for making this time for us. MIOT Hospitals is celebrating 25 years of integrity in healthcare this year. Where did this journey begin, and how do you see this decade's worth of healthcare services offered by MIOT International to patients from India and 130 countries across the globe?
So MIOT started as a small 40-bedded hospital around 25 years ago and was opened by my father, and the main goal of MIOT was to try to reduce the number of Indians going outside the country for treatment. So when it started, it was just a single specialty hospital, only for the specialty of orthopedics. But over the years, obviously, as the Indian country's reputation for giving good and reasonably priced healthcare has increased, we've started getting patients from neighboring countries, and slowly now in 2025 we have grown to seeing patients from 130 countries accessing our services. And if you want to really see the landmark scenarios achieved in general in healthcare over the last decade, I think is the remarkable leap in technology in terms of diagnosing disease early, as well as ensuring that no disease condition is termed as without a cure. And I think these are the two remarkable areas that are just incredible in terms of patient experience in healthcare.
All right, and MIOT has been serving the people of Seychelles for many years now. How do you reflect on this relationship or partnership, and what impact do you think MIOT's healthcare services have on the local community in Seychelles?
Well, I think the Seychellois people are a pleasure to deal with. They're extremely positive, polite, receptive to new technology and to a different cultural experience with the hospital in India, MIOT, or with specialists from MIOT that come here to Seychelles. And in terms of the relationship, it's grown. When we started 15 years ago in 2009, 2010, it was basically just patients for overseas treatment. But over the years, we've built very good trust with the various ministries here, especially the Ministry of Health. We've got excellent exchange with colleagues, both in the administrative and in the clinical side. And of course, recently we opened, a local treatment day unit here at the Espace building in Seychelles. And hopefully in the future we'll be able to offer more treatments from our own purpose-built facility that should open in the end of this year, 2025.
All right, and MIOT is also known for its infrastructure, investing in state-of-the-art equipment and biplane cath lab to robotics in surgery. A few words regarding that.
Well, I think that every patient who accesses healthcare would like their treatment to be comfortable as possible, and also to have very little permanent side effects. For example, if you're going for brain surgery, you don't want to be left paralyzed, or if you're going to have a heart surgery or cancer surgery, you don't want to have a huge risk of dying during the procedure. So to make these treatments safer, especially if you're going to have treatment in a critical area that either has a lot of nerves or blood vessels, you want to have techniques that are very, very safe and have very, very low risk. So one such scenario is to use a robot to help you to go into areas with better vision and with better instrumentation, and definitely robotics plays a great role there and makes the treatment very safe. And the other is to perform the treatment without requiring anesthesia, without requiring prolonged stay in hospital, and with very little pain during the treatment delivery. And that is where interventional radiology via a cath lab, or as you said, a biplane cath lab with cone beam CT and 4D ultrasound comes into play, where you can actually give treatment without opening the patient through what we call a pinhole.
MIOT is raising global awarenesses about genicular RT embolization, a groundbreaking procedure that has now become the topic of the hour. Could you explain why this procedure is considered a breakthrough in treating osteoarthritis, knee pain, without surgery?
Well, the number one arthritis affecting joints in the world is knee arthritis, and that applies to Seychelles as well. The big problem with knee arthritis is the two groups that you have to deal with. One, the very young patient with severe arthritis of the knee, and two, the elderly, grossly overweight patient with severe arthritis of the knee. Back home in India, which is a very poor country, the big determinant is cost, and the second, of course, is fear. So fear because you're very young, say you're in your late 30s or early 40s, and someone says, hey, you need your knee joint replaced. And obviously, you're not wanting to have a foreign body sitting in your leg. And secondly, you're thinking, my God, if I go back to my usual activity, this joint is going to wear out and I'll need surgery again. The other end of the spectrum is when you're an older, very overweight or very ill patient, and you start developing severe arthritis in your knee. And you're afraid to let somebody give you an anesthesia. You're afraid to let somebody make a big cut and open your leg. And you just have this fear that if you have surgery, you may not have a good quality of life because you might either have a risk because of the surgery or you may not recover well after the surgery. So why is genicular artery embolization such a game changer? Firstly, the process of arthritis involves overgrowth of the lining of the knee, called synovium, which then destroys the knee and then produces severe crippling pain, no movement, and basically no normal active life. So the reason why this lining overgrows and starts destroying the knee is because during the process of arthritis, numerous new overgrown blood vessels start producing excess blood supply to the synovium, and then that starts the disease process going in a very severe form. If you can block these new blood vessels and prevent them from being produced, automatically you arrest the disease and you'll be able to reverse the disease and get the knee back to normal. So through a pinhole in the thigh, you go into a big blood vessel of the body that is supplying eventually the knee. You find these new, smaller, unnecessary, overgrown blood vessels, and you use MIOT-compatible particles to block them via this pinhole. And after this procedure is done, the patient doesn't have to stay in hospital. They go home after 6 hours, and in 3 to 4 days, this overgrown lining called the synovium reduces to its original normal size. The pain goes away, the swelling goes away, the movement comes back, and you can return to normal activity. And even if this disease were to come back, it takes 3 years for these blood vessels, if they're going to come back, to regrow, and you can have it done all over again. But most importantly, in a price-sensitive market, it is 1/5 the cost of any other knee treatment.
Interesting. And what exactly happens during the genicular artery embolization procedure, and how does it help alleviate knee pain?
So you don't need surgery, and you don't need admission to stay in hospital. Also, you could be extremely unfit, you could be obese, you could have other medical conditions, and you could be on a whole load of other tablets. It's not going to affect your procedure. So you come to the hospital, you have certain x-rays called weight-bearing x-rays of the knee. One knee is treated at a time. You can't have both done at the same time. You lie down, you have a little needle going into your thigh that accesses the blood vessel in the front of your knee, and through that needle a wire like a little hair is threaded in, and then on a screen using x-ray the exact smaller new end blood vessels that supply the synovium are identified, and then biocompatible particles that block or embolize these small blood vessels are injected, and then the wire is withdrawn, and that's about it.
Right. And is genicular artery embolization an effective alternative to total knee replacement?
Hugely so. Genital artery embolization has been published. The results have been published widely. It's been FDA approved. It's approved by insurance companies, so they will reimburse you. And in fact, in 2024 alone, we performed over 100 procedures, and 96% of our patients had no pain at all after. In many parts of the world, this is now a groundbreaking treatment because it's hugely acceptable for the patient, because they really don't need the whole scenario of having a big major surgery and then taking 42 days of rehab to recover, etc. So yes, it is catching on in a big way.
Okay. And who are the ideal candidates for this procedure?
There are two ideal candidates. One is the very young patient who feels that because he's young and he wants to go back to full activity, he does not want an artificial joint because it might need him having multiple surgeries of replacement of the joint to the knee. And the other is the elderly patient or the grossly overweight patient with multiple medical problems that makes it scary for them or high risk for them to submit themselves to an anesthetic and have knee replacement surgery. So these are the two groups.
All right. And how long does it take for patients to recover after the procedure and experience pain relief?
Yes, so recovery is 6 hours, so you could go home after 6 hours. And as I said to you, this overgrown synovium has to reduce in size, so that takes around 3 to 4 days. Sometimes, if you've left the disease to go on for too long, it might take a week. And after that, if you've had the disease for a long time, the quadriceps, or the muscles in front of the thigh above the knee, are weak, so they take around another week or so to build up. So worst case scenario, it'll take you around 3 weeks, and best case scenario, it'll be a week.
All right. And could you share a success story about the patients who regain mobility after undergoing a GAE at MIOT?
Well, we have around 96 success stories over the last 9 months. And we've had the Seychelles as well who've come. But the one that stands out in my mind is this young mother from Maldives who came to us with a special needs child. And this young mother has been confined to a wheelchair for the last 2 years because both her knees are so severely affected, and she's very, very upset because she can't look after her child. And her husband brought her over from the Maldives, and she had one side done, and then 3 days later the other side, and in 10 days time she didn't need the wheelchair anymore, and she was able to look after her child, and that family's life was just transformed. So we found that so incredible.
And with MIOT's expansion into Seychelles, how do you envision this procedure helping the Seychelles?
Well, I think one of the biggest advantages of this procedure is that you don't have to have an anesthesia and stay in hospital. And especially in a country like Seychelles with similar patient requests like we have in India, it's a very, very affordable procedure. So imagine if Seychelles, compared to doing 100 knee replacements, can have 100 genicular artery embolizations, and you're saving 1/5 for each procedure. So that's a huge expenditure slash of total expenditure divided by 5. So I think it'll be a huge benefit if it can be rolled out in this country for the people of this country.
And what are MIOT's future plans for expansion in Seychelles and beyond?
So definitely to try to offer minimally invasive procedures in Seychelles so that people can recover quickly. Definitely to try to reduce the number of people in Seychelles who are going overseas for treatment, because a lot of people in Seychelles like to go to countries like Sri Lanka, like the UAE, and of course India, sometimes even for diagnosis. So this is really, these two goals really are thrust for the Seychelles and also other countries in the region.
Right. And I would like to thank you for your time.
Thank you.
As MIOT looks to the future, what message would you like to share with the Seychelles?
Well, I think technology is changing every month, every week. We are very excited at the way diagnosis has now become so much easier, so much more reliable. And with AI coming in, I think there can be a lot of offerings that will bring the best that the world has to offer in Seychelles to the people of Seychelles at their doorstep.
All right. Thank you very much.
Thank you very much.